Well, I was diagnosed in '05 in October with breast cancer.
Because I didn't see this coming. I had done everything right, gone to the doctor every year and done everything right, and I didn't see it coming.
When I went to Dr. Bonebreak, he examined me and he said, "You have cancer."
Nobody could ever believe that that you have cancer. But if I wasn't in that clinical trial, I would have never known. And it would have been too late, probably, when it was found.
Within a few weeks, we realized that I had been diagnosed with Paget's disease of the nipple.
But if I hadn't been on the first clinical trial, which was a prevention clinical trial, probably I would have gone 5 or more years and would have had a more advanced prostate cancer than when it was found because I was on the trial.
The theory behind the study was that a more aggressive treatment would have better outcomes for people with more aggressive tumors. And so that's why I opted to participate in it.
A diagnosis of cancer can be devastating. Fortunately, Cancer Research of the Ozarks, a partnership between CoxHealth and St. John's Health System, provides access to clinical trials offering patients promising new approaches to cancer treatment.
Cancer Research of the Ozarks is a National Cancer Institute funded program that brings clinical trials to the community so that patients who are in the clinical trials or want to be in a clinical trial don't have to drive 200 miles. And in the Springfield area, they'd have to drive almost 200 miles in any direction to be participate in a clinical trial.
You may be asking yourself, why would I want to be in a clinical trial? Well, there are several benefits that come with participating.
In doing cutting-edge care out in the community allows us and our patients to participate in the best therapy they could get anywhere, and allows us to provide this cutting edge in an organized fashion to advance our knowledge and at the same time help our patients.
Let me stress, choosing to be in a clinical trial does not mean you're choosing between the standard treatments and the clinical trial. You'll be receiving both, which could dramatically increase your chances for survival.
Well, I didn't know anything about a clinical trial, and he told me different things about it, and he said, we'll start with one type of medication, and then he says, if during that trial they decide that something else is better for you, why, we'll switch to that treatment. And he says, you think it over, and if you want to be in this clinical trial, you might be able to help someone else with their cure. And I thought, well, I might as well do that. If I could help someone else, I would. So then I decided to do that.
There are different types of clinical trials. Some trials are for treatment of different types of cancer. Others are set up for healthy people to find out what prevents different types of cancers. These trials are open to healthy people and may use promising medications approved for another use, or vitamins and supplements believed to help lower the risk of specific cancers.
Somebody got to do it, so it's just something I decided that would be beneficial not only to me, but maybe on down the line to other people, or what they might find this study does. So.
Prevention and cancer control trials may also involve medical procedures for people who are at extremely high risk of developing certain types of cancer.
It's the opportunity to use maybe better therapy than what we know. And I abhor the fact of using known effect in what's really inferior therapy that works a low percentage of the time, and yet that's traditionally what we've used, when we can maybe find something that might be better and move out of the rut that we have predictable effects and predictable, not as good as we would like, survival rates.
Each clinical trial has guidelines for who can participate. Eligibility criteria are different for each trial, and each participant must fit exactly into the protocol's requirements.
We do have specific criteria that we look so that we can put people on the same playing field as much as possible.
Some criteria may include age, gender, medical history, and may call for patients to have a certain type and stage of cancer. Your doctor and research nurses will explain all details about any clinical trial for which you may be eligible.
Marcia came and talked to me about it and helped walk me through it. They had some information, a packet on it. I did the research and the reading that they had, and all I had to do was sign up. It was very, very easy.
Once you start a clinical trial, you're free to change your mind and stop at any time. Or your doctor could recommend that continuing on the trial is not in your best interest.
If for some reason down the road I wanted to get out of the trial, I could. You can stop it at any time. I don't think I will, you know, because I feel like it is for my benefit.
Most physicians have an interest in clinical trials because we get frustrated in seeing malignancies that we have nothing that we can do, and we want to try to do more for the patients, to try to improve the outcome, and clinical trials are how we improve the outcome.
These studies have to be approved, first of all, at the national level, at the National Cancer Institute. They are reviewed for scientific credibility and safety. And then at the next, then at the local level, before we can implement these studies again for patient safety and patient protection, they have to be reviewed by a local review board that is a multidisciplinary board. It includes professionals, physicians, but it also includes lay members who are especially concerned about individual patient safety and question, and they're very good at looking at the study.
Cancer touches all of our families, but there is a way we can all help. Clinical trials have advanced treatment dramatically over the years. If you are a cancer patient, talk to your doctor about a clinical trial. If you're healthy, you may be eligible for a cancer prevention trial.
If I could help women, you know, a few years down the road, yes, that's really the reason you do it, and that's why I wanted to do this.
I want to be a grandma. I want to be here for a long time, and hopefully what I'm doing will help their generation and the next generation to come.
I'm doing this because on down the line it could help not only my sons, but younger people clear on down the line. You don't know what this study is going to prove.
Sometimes you have to ask yourself, is this something that I should be doing? Not for myself, but for people down the road who are suffering from the same thing that I am. After all, the treatment that you are receiving today, in the past, sometime had to be done as a research study. The only way we get new drugs and develop new treatments is to test them.
So it really saved my life. Well, I believe in clinical trials, believe me.